Today is historic. I know you are a health ambassador. Since you took over, you've been talking about health programs, health policies. But why it is historic is that our immediate past Rotary international president came here, and there was a demand for the construction of a triage. So you are fulfilling his promise. He assured the health management here that very soon a triage will be built. We are also filling a gap. When patients come here, until we have built this now, they used to queue. They stay in the sun, even if it is raining. Now this triage is saving the patients some time, and they will have a little rest place. Their vitals can also be taken in this triage. So the last time we came here, we were led here by our charter president, Princess Joy Okoro. The matron here, Mrs. Osford, still demanded for this triage. And to God be the glory, these club members, they have contributed 2.2 million. And it is what we have spent to build this triage. We thank you for the opportunity to serve humanity. And we are sure you will continue to do our best.
Thank you so much.
Mrs.
Madam.
Very well in this place, because number one, if you can turn back, you will see somebody standing down there taking people's vitals under the sun.
Yes.
Before this time, we had these COVID precautions that we are doing, that before you come to the facility, we must to check all your vitals. So now, we now do that under the sun. That's what we do, under the sun. So even if we have a case of suspected case, we can't put them anywhere. You understand? So it has been a burden on us. So when they came around, we were so happy and said, this is what we need. Even under the sun, we put them under that place to go and stay. And if you go there, the smell there, the stink there is terrible. And they will be complaining. I wish you are here maybe earlier than this. You would have understand what we are saying. The joy in our heart for seeing this thing coming to play. So it's going to help us a lot. Presently also, the federal government has brought on about free BP screening and sugar testing. And we can't also do it inside there, because we are supposed to catch the people as they are coming in. So I also want to use that privilege of using that particular side to do it. So that's why, in short, we are very grateful for this opportunity. So thank you very much, Rotary Club Maitama.
Thank you, madam.
Yes.
I see why I like this. On Sunday, I commissioned a bus stop in Buhari area. And I asked them, because if we do things that are not... On behalf of all Rotarians in the district, and indeed the Rotary International, because this promise was made when the Rotary president came here. And today, the Rotary Club of Abuja, Maitama, has fulfilled that promise. And it is my honor and privilege, to the glory of God and to the service of humanity and for the use of this. And we do that, glory of God and to the service of humanity. We break this. I'm very pleased because I've actually did a very serious study when I was in NIPS about primary health care delivery. And we found out that we're not doing very well on that. And we did a full report, which hospitals where women and children were sitting on the floor while waiting attention. There are some even primary health care centers built by Rotary that are not being manned, are not being utilized. So that's why we're engaging the FCT for the ones built in Abuja alone. Let them get people there. And that's why we also are thinking about building a 24-hour hospital to be manned by Rotarians who are in the medical field. So at any time, we're going to have solar energy there, we're going to have inverter, we're going to have regular power supply, and we are going to have our doctors and nurses work there on shift basis. And where we can, we get help here and there. The essence is to make sure that people get it, because if you just build them, Rotary Club of Karu Housing Estate just completed a very big and beautiful primary healthcare system. If you do not get people who will work there and you do not get medication for them, then it will be useless. And the thing is to maintain them after building them. And I believe that for every community that we have taken, we try to build things, provide water, those things that will reduce ailments. If you don't drink good water, you get sick. If you don't eat well, you get sick. You understand me? So what we do in Rotary is to help as much as possible to provide those things that will stop it. Okay? And we are thinking, all the presidents have agreed with them that we are going to do a mega water project somewhere in Abuja. The framework is being worked out, and I believe that by God's grace, we'll be able to achieve that. But in terms of primary health care, I can tell you, I don't think we are doing very well, but we in Rotary are taking it very, very seriously this year. And that most of the clubs are going to build primary health care, and again, make sure that we get people who will man them and reach an agreement with the FCT to make sure that those areas are manned and medications provided and all the things that we need for the vitals are provided.
Thanks. You assume office not up to 1 month, and you are able to do this.
If there is a will, there will always be a way. And you know, Rotary is like a moving train. It doesn't tell, our activities do not stop. We have good transition. We had conceived this in the last Rotary year, and we were able to fulfill it. Like we had the DG said, the immediate past Rotary International President came. He made a promise, and we fulfilled the promise.
Where next are we going?
Well, when you expect more actions, we are people of action. So there will be more activities. We are investing. There is even we are trying to build a maternity ward. We are building a school now at present. A lot. Please.
Tell us about this project,
It's a triage. It's a waiting bay for patients. Patients, when they come to this clinic, they'll always stand in the sun, or sometimes they use temporary shade. Now we have bridged that gap by providing this where they can take their vitals, and to provide little comfort for patients before they see the doctors. So it's a very nice project. It's a 2.2 million naira project, and it's a quick win project. Thank you so much.
Thank you so much.